This is Hold My Stethoscope.
Look at her adjusting.
Welcome back to Hold My Stethoscope. We are so excited to be welcoming our first guest of this season as she figures out the best angle for herself. But very excited. So, for those of you who don't know, I am Brittany, and I've got my friend Felicia, my beautiful
Alicia.
co-host. And today we have our lovely friend Julie. You want to introduce yourself and tell the people who you are?
Yeah, my name is Julie, and I know these gals from the ER. I worked with them for about 5 years on my part, so that's pretty much how we all have been entangled.
Yeah, it's been, I feel like at least for me, it's been a little bit since I've seen you last, but you have transitioned into the whole new world of advanced practice nursing, and you are now a nurse practitioner that we're going to be talking about. But before we get into what you're doing now, let's give everybody a chance to get to know you. Where did you come from? How has your journey in nursing been? Like,
Yes.
let's dive in, girl.
Let's hear about your
Let me get
journey.
comfortable. Okay.
Yeah, everybody get
Actually,
comfortable, get your drinks. Let's do this.
Yes.
I'm a very late bloomer in the medical field. I actually transitioned, I became a nurse when I was 36. So I started out, in college. I did my bachelor's in psychology because all the screwed up people go and get their psychology degree. And from there,
Right.
didn't really do anything with it. Fell into like the car business, was selling cars, got into finance. I was making a lot of money at the age of like 24, strip clubs, drugs, I had a house. I had two cars, a motorcycle, a Rolex, high roller, like crazy.
You were
Felicia's heard a
living
lot
the
of my crazy
dream.
stories.
Great stories.
So,
Yeah.
Great.
what were you doing like in the finance world?
I was financing cars.
Okay, like legit, just okay.
Julie had my car, the car that I drive right now. She did it on the phone. I
Yeah.
had her on the phone while I was in the dealership, and she was like, "Nope, you're not doing that. You're not getting this. You're gonna get this. You're gonna do this."
How
And
did you
that's
initially
how
get
my
into
baby
like
came about.
that sales world? Like, how did that
One of my
transition
best
from college?
friends, one of my best friends at the time, I ran into her out at the club and she was like, "Oh man, you got to come into sales. Girls do great in sales. People believe what they say and people will buy stuff. I'm making so much money selling cars." And I was like, "I ain't gonna sell cars. I got like a degree." And then I was like, "You know what? I was all about the money." So I went and I fell into that. I did sales for a year and a half and then I did finance for like 3 years. And then I bought all my stuff, got all fancy. And then it's actually funny because working in the car dealership was when I actually transitioned into medical. So I randomly was like, a buddy of mine was like, "I'm going to drive up to HCC and get a firefighting application to get into fire department." And I was like, "Fire department? You know what? I'll go with you." Like, but he's also the guy that's how I was. Like he also is the guy that when I was working with him, I rode his motorcycle for the first time. 3 days later, I went and bought one. Rode it like once, bought a motorcycle, didn't know really how to ride one, didn't have a helmet, just went and picked one out and 3 days later rode it home. So that's how I was. So yeah. So we went to HCC on the back of his bike. I got a firefighting application and then I realized like you have to have your EMT before you go into firefighting and all this. So I had to go to EMT school. So I went and did EMT and then 2009 I did the fire academy during the summer. Then so I wanted to be that, really cool person that had a great schedule and had a lot of women and as a firefighter. And the day that I graduated the fire academy, I earned a pair of silver bracelets.
No.
I didn't talk about it a lot in the ER. So I got arrested the day that I graduated the fire academy. I got arrested. I was celebrating and, not, so I didn't blow. I know y'all are
Okay.
spies. And so
This is gonna be the best episode ever.
So, I went and sat in that,
So
for 8
advice,
nights.
don't blow.
Right, exactly. So, yeah, so became, a statistic in the world and lost my license. And I had just got an EMT job with an interfacility company, but then I lost my license, so I couldn't drive the ambulance. Firefighting got put on hold because you can't get hired for like 3 years minimum with any kind of arrest because you're a liability. If you're drive, think about it. If you're driving their vehicles,
Yes.
so
That makes
so
sense.
it's kind of funny how I transitioned into this field. And so from there I worked at the ambulance company as a non-driver. I just, worked in the back with patients, and I volunteered to keep up my certification. And after a year of volunteering, I was like, listen, I don't like to work for free. I just I let it kind of lapse. I went and I got my medic. And then as a medic, I started working in the ER. And that's when I started falling in love with the medicine side of it. So I started going back to school to get all my prereqs for nursing, because a psychology degree, you don't have anatomy and micro, you don't have
Right,
any of those
right,
facets.
right.
I had to go back to school as an old person and go and get all these, like, probably had to take another 6 classes. So while I was working full time, I was taking classes part time. And then I did a RN, a no, a medic to RN bridge program. And so I got my ADN in like 10 and a half months. I got my 2-year nursing degree. And so at that point, I was already like working in the ER a lot for probably like 4 or 5 years as a medic. So I had a lot of knowledge. I asked a lot of questions. And then, I gave up on the firefighting dream
Okay.
because I was always going to be the person who was older female with a record. And they have so many people that they're graduating all the time that I was always going to be pushed to the back. No one's going to pick
Okay.
somebody like me because I'm a liability.
Okay.
So I
Is that
just
what you really
gave up
wanted to
on
do
it. I
though?
let
Like, did you want to like go into firefighting, or was it just something you kind of landed and were like, okay, cool, and then pivoted because it wasn't happening, or was it something you always really wanted to do?
no, I didn't want to do it until I was working in the car business and my buddy wanted to
And the
do it.
buddy said it.
Well, because that's
I
the
was like,
other
that
thing is
sounds
you
really
hear like
cool.
people like how they get into the medical field. It doesn't sound like you ever had that plan like at all. You
Nope.
just
And
somehow
neither
wound
did
it up
I,
here.
Julie. Neither did I. I was gonna
Yeah, I remember
Mhm.
that. Yeah.
Yeah.
So I fell right into this and just ended up falling in love with the medical side. So it worked out, and then after my 2-year, nursing, I'd already was working and I already knew pick lines. I got trained as a medic in the ER how to do picks and midlines. And I picked up for, even though it's a nursing skill, trained me. And so I worked for their department and I picked up call at night. And then when I actually like transitioned into a nurse, they hired me into their department. And then from there, my first full-time job was at 16. I got hired. I was already PRN with IR and pick, but it was my very main gig. 5 years I was there. And that's where, I met Felicia. And yeah, lots of
That
stories
occurred
there.
for 5 years. It was 5 years though.
Yes. Great stories in the
Yeah.
morning.
I was there from 16 to 21, and then I got fired.
So look, you wouldn't be where you are today.
I ain't worried
Yeah,
about it.
everything happens for a reason. Like exactly, you're doing great now. It is what it is.
Yeah.
So,
I didn't wanna be
dur-
a nurse practitioner either though.
Yeah, what's up? What tell me? Yeah, tell me
yeah,
about that.
transition
How
there.
did you end up?
Like, when I say I wanted nothing to do with medical, like, hands down, none of this was a plan. So, I was married at the time, and she had just finished her nurse practitioner, and it was one of those, "Okay, it's your turn," and I was like, "But I don't wanna go to school. I've been to school, and I've done A through Z," and it was kinda like, "Well, you can't be bedside forever," and I'm
Right.
like, "But I can." Like, I love the adrenaline and the
You
trauma.
didn't love that.
And it was one of those, honestly, she said, "Well, then I'm gonna go back to school and get my DNP." And I was like, "Okay, I guess okay, yeah, sure, I'll go back to school." So I ended up going back to school and getting my NP. And I mean, I never even talked about it. Most people didn't even know I
No,
was in
we didn't
school.
know.
Most people brag and they're like, I was just like,
You didn't want anybody to even know. I saw you with a backpack one day. I was like, where's this heifer?
yeah. Yeah, for two
And
and a half
she
years,
was
I
going
just
in the cafeteria. She did not want anybody to know.
no,
Next thing
nope.
I know, she was done.
Yeah, I was done and I graduated and I posted online and I was just that was it. And I got fired May of 2021 and I graduated that December. So I took off like
Wow.
um I took off like 6 weeks. I had a bunch of PTO I got, then I focused on knocking out like clinicals and had to deal with a lot of personal stuff around that time. And yeah, and then I started working at after worked at on their pick team. And and I still work there. It's my little fun side job. I work as a nurse there on Thursdays and do all the pick lines and IVs and then I fell into ID. Girl, I didn't want to do ID. I shot my resume around. I didn't pick ID.
I
I didn't
never.
know what you know what I said? I said, I don't want to work ER and I don't want to work in urgent care. I don't want weekends and I don't want to work holidays anymore. I said,
Right.
I'm ready for a Monday through Friday office job. I don't care if it's primary care. So I shot my just resume everywhere and the ID doctor called me. And I didn't even know what ID did because in the ER, you don't see them.
You don't.
No.
You don't.
And I hated antibiotics. Antibiotics were the hardest things to learn. And I was like, how the hell did I just get an ID job? Like what just happened? But
Mhm.
he sold me on like, you're every other weekend and it's hospital based, but like you come and go. There's no clock in, there's no clock out. You look up people from home, you can round, come home, you could chart. Girl, I'm home more now than I have ever been in the 45 years I've been on this earth. I have
Wow.
so much downtime because I just handle a lot of stuff at home, phone calls, changing things online because you have that, right at your fingertips, everything.
Huh?
So yeah, so now, May will be 4 years.
Wow.
I got hired end of May of 2022.
Yeah, she's right. Think about it, Brittany, because I've been
That's
doing
crazy.
education now over 3 years.
Yeah. So, and I love
That's
it.
crazy.
Wow.
Time
I love
flies.
it. I love it. I love it because you're like the investigator a lot, like you're consulted to do all the digging and to find out, what's going on and what's the infection coming from because nobody else could figure it out. Why do they have a fever? And you're ruling out like you're consulted for everything. I'm on like UTIs, I'm on pneumonias, and I'm on every nasty foot. I'm just saying. Like, I mean, toes where you're like, shit, if I touch that anymore, it might fall off. It might fall off.
Right.
Yeah.
So, like,
So
you told us a little bit about that, but like, do you see patients in like the office? Are you just consulting in hospitals? Like, how does your day to day look?
I am, I am like 98% hospital. I have one office day on Fridays, 8:30 to 12. That's it. And I hate office.
So you rather be out rounding on the unit.
Office
Really?
is just because when you're in the hospital, you have all your resources there. You got your tests, everything's right there. And when you're outpatient, you got to order these things. You got to hope the patient goes to the lab. You hope they schedule their imaging. You hope they go see their podiatrist or whoever else they should be seeing. You're hoping they're doing all the things they're supposed to do, but they don't. Because think about it. The ones in the hospital are in the hospital because they don't do the things they need to be doing.
Absolutely.
Nobody does anything they should do.
No,
So
that's true.
in office, I don't have the resources. I'm like telling my office person to like and call their ortho. Why didn't they see ortho? Like everyone comes back and they just haven't done their part and you're just like running around with like a chicken with its head cut off because you're lacking of all the resources to be able to get anything done. And I don't like that. I don't function well like that because I want to do it now and let's get it done right now.
Right.
And then when
Right.
you work on a Friday, that's the worst part because if you get something done Friday, you don't find out till next week,
That makes sense. True. True.
So,
Wow.
but
Was it a hard
So,
transition going
yeah,
from that bedside nurse into this? Like,
it was because, you have to know you stay in your lane.
okay,
So, when the ER, we're all looking at the big picture and stuff,
we're
and
all
that
over the place. Right.
right. Even though that this is an advanced role, yeah, you're still that nurse where you're walking
Okay.
in and you're seeing all these other things and you're like, well, why is their heart rate 160 and their max?
Stay in
So
your lane. That's what you
yeah, I'm
need.
trying to yeah, because I see everything, so I'm not cardiology, so it's
Right.
kinda
Oh,
like
yeah, that's tough.
it
It's
is it's yeah. You have
oh,
to, like so that was a real hard transition and, but I still, like, if I feel like something's not wrong, or something's not going right, I
you do
definitely
say something.
I do. I've got real good rapport with a lot of, like, the nurses, they have my number, a lot of the hospitalists, other providers, so I feel that I saw a lot of lack of communication between providers. How many times did a patient get wheeled up from the ER to go get admitted and the patient didn't even know they were getting admitted?
A lot, all the time.
All the time.
Yep,
So
all
I
the time.
remember that barrier of, like, the breakdown of communication. So, that's like I don't wanna be that person. So I'm in my rooms, I communicate. I mean, I have them tell me, "Man, you're more thorough than your doctor." And I'm like, "Because I'm still a nurse."
'Cause I'm still a nurse. Exactly.
That's what we are with them longer than the doctor. I
Exactly.
explain it to them, I sit down sometimes, so but that's what's been different too, but I don't mind, I like talking to them, so
That's awesome. Oh, I'm so proud of you. That is
So,
just
well,
amazing.
that is like a really good point because, we have talked a lot about the problems in healthcare, and there's so many. We could talk about it for hours and days and years and weeks, whatever. But how do you feel like in your new role you are kind of making a difference with that inner communication? Like, how has your role now let you kind of coordinate or help coordinate care, or is it made it more frustrating for you because you're not able to help with coordination of care?
well, I know that my patients are taken care of. I can't win them all. I can't save everybody, but, like, I know that I tried my very best to try to break those walls down so there's communication. I communicate with the hospitalists. I don't leave until I run my list with them. "Hey, this is what I'm doing." If I don't see them, I message them. It's just I'm just from seeing so much breakdown of that, like, I don't want my patients to leave there not knowing, and it's amazing how much patients are clueless. Like, I could walk in and be like, "Okay, so you got, an infection in the bloodstream." "What?" And I'm like, "Nobody's like I know I'm ID, but, like, nobody's mentioned it to you?" And, "No." And, like, some of them just have no idea
Right.
what's going on. So,
Right.
I explain everything to them and I make sure the hospitalists know and I communicate personally with the surgeons, podiatry, you name it. I'm messaging everybody. So we're
Okay.
all on the same page. So I know that I left. And let me tell you, when the documentation as a nurse is even more important now in this role. And let me tell you, I'm not here to sandbag people, but you better believe if I spoke to somebody else and we're on different pages, I spoke to Dr. So and so
Absolutely.
and recommend this, like, and you just got to put it in a way where you're not like
Right. Like
asshole,
right.
but I still protect me because when my patient gets discharged on the wrong antibiotics and that was not my recommendation, you better believe my notes will say my recommendation. And if somebody gave pushback, I will somehow make it say that they were on a different page.
Got it. Got it.
So
Do you see these
How do
patients
you
every day?
every
Yeah.
day
Every
I
day.
do. I stay on them until they leave.
Okay. Okay.
Yeah.
and kind of going back to like
What do
What
you
were you
say?
gonna say,
communication
Brittany?
piece, like, well, I was just kind of like communication's so big. We talk about that all the time, but like how, I guess, in your role now, do you think, I mean, I know it's going to be hard, but do you think communication can be improved amongst like interpersonal, providers to be able to provide
Yes.
better care for our patients?
Yeah. You have you have chat. Like right now we use Epic and but
Hmm.
see there's chat on that. And then if you're not on your computer, like I have chat on my phone. Like there's no
Hmm.
reason why it's laziness. People don't wanna take the time to shoot the nurse a message or or the nurse to shoot the provider a message like, "Hey, this happened." Or, I hear a lot of the providers, they complain a lot about, "Oh my god, they reach out to me over the smallest things, but then this big thing happens and they just don't tell me." But I think that's
Hmm.
the level of nursing, obviously. where people
Yes.
over communicate the small
Yes.
things, and but I don't think we're going to fix those things, but there's no reason between phones and emails and text and chats, like there's no reason why there shouldn't be communication. There's no excuse why somebody can't talk, because even
Exactly.
on my day off, doctors text me, "Hey, patient in this room." I still tell them, like, even if my doctor's covering, if I know that patient and I've been seeing them the past 4 days, I'm going to know more about that patient than my doctor.
Right. Right.
It's easier. What's it gonna hurt me to pick up my phone if I'm not doing anything and just be like, "Oh, yeah, that patient can go on blah, blah, blah." Like,
Absolutely.
because my doctor's busy, he's gonna have to review that entire
My
patient,
chart. Yep.
so, like, that stuff I don't mind, and that's why they respect me, because I'm available to them and I communicate. So the providers love me because I over communicate, but the breakdown of communication is people being lazy.
Yes.
That's providers being lazy, not wanting. They're trying to make it to where nurses are supposed to round with the doctors.
Yeah.
So,
Yes.
but we all know how hard is that. Everybody comes at different times. I
Right.
round sometimes at 7, but if I have my son, sometimes I don't round till 10.
Right.
And it just depends what time everybody comes in. And if you're in the middle of doing something and you can't get in that room, but there should still be a form of, communications. I'll message them. If there's something I need to talk to the nurse, I'll message them. I communicate with all of them. It's easier that way.
That's good. That's really good. And I'm sure they feel comfortable reaching out to you. Oh, we know we'll get the answer from
Yeah.
Julie. So that does help, because that is one of the biggest concerns that the nurses have right now is they just can't communicate with the doctors. Like I have nurses right now on the critical care unit that are like, I get patients that are coming up without post-op orders and they go to reach out to these physicians and they just can't even get a hold of anybody for days.
Cerner? Does Cerner have chat?
No.
That was
I
probably so
know.
when we went to Epic and I got that chat, I was like, at first I was like, "Oh my god, it's gonna blow up." Like, nonstop blow up in the middle of the night, this and that, but, like, it's been great. Like, right now, I unfortunately, for over a month, my Epic on my phone is down and I'm losing my mind. So, I've worked with, like, 5, 6 different people with IT and they can't fix it. So, what I did, because people are messaging me and I don't get it on my phone, if I don't have my laptop in front of me and I can't communicate. So I just went into the Epic default and I put my phone number there. I said,
Okay.
"Hey, sorry, my phone isn't working. Please text me if you need me. And here's my phone number."
I'm not familiar with Epic, but I get a lot of team members that have come from an organization that use Epic and they absolutely love it. Cerner is difficult
Yeah.
for most people who aren't accustomed to that. They love Epic. I don't know Epic at all, but I hear great things about it.
Yeah. No, it's
Like
pretty
nice
neat.
hard stops and different things. Like they don't go through too many issues with things not being charted because they
Right.
get these hard stops. And I think that's great.
Yeah. I think everyone's gonna end up going that route, because even though, like, so we just went to Epic in the office, and then when
Okay.
the hospital opens, it'll be Epic. So your Epic systems, they kind of talk to each other, they sync notes, but your MRNs are different. I
Okay.
learned that the hard way. So, like, in the office, because I see patients, the office has to print. If they print a note from our Epic system, I can't pull the MRN up by that MRN if
Okay.
I want to see that system. So,
Okay.
but they are syncing at least. So before I was in the office, I had the office system called Entergy. I had a sister that was Epic, and I was like toggling between like all of that stuff. So now it's nice that the systems talk, but I think even Moffitt's talking about going towards Epic,
Think so.
and I think that's going to end up being the way of the world at some point.
It's Epic's amazing. MSK is another place that uses Epic, and it's great because they can download like pictures of things
Yeah.
that you had done, which is something that Cerner just doesn't do.
Right.
So,
Yeah, it's pretty easy to navigate. I don't know a lot of it on the nursing side. I only really know it on the provider side,
yeah.
so it's very different when you're trying to look at it from the nursing side and provider side, but
Okay.
yeah.
Okay.
So,
Okay.
provider-wise, it's great.
Hmm. The nurses seem to like it on their side too, so it must be an overall good program.
Yeah,
Must
I
be.
think so. I think it
Wow.
helps with the communication too, and yeah.
Mhm.
Yes, absolutely. Absolutely. And they only know certain but I've heard wonderful things.
Well, we all need to be on one.
We do.
It's hard when you have somebody, come from a different place. You know how it is, and you gotta get their records and this and that, and, like, the systems don't talk, like, it's still like that on the provider
It's a
side.
lot.
It's
Yeah.
still frustrating because
Yeah.
people it's a thing, people go to all different systems, they, "Oh, I was at what Baker, now you're over at App," and you're like, "What are we doing here?" But it's a thing, so we need something to be able to talk, and
So
that will
you work for more than one organization? Is that what
so
you're saying?
I'm I work for Florida Medical Clinic Orlando Health because
Okay.
Orlando Health bought us out, but we're contracted in Advent Systems because we don't have a hospital.
Got it.
So when we were Florida Medical, you're all specialties, primary specialties, and so we worked in the Advent system. I think some of the which is a hospital system, has come in and swooped us up, and we have a hospital opening. So now Advent's trying to kick us out. It's a business at the end of the day. It's not
Right.
about taking care of people,
Right.
unfortunately, and I don't like it, I hate it. I love where I'm at. A lot of people don't like to go to Dade City, but I've been there so long, and I know a lot of the people, I know the way. I mean, they brought in another group, an ID group, and they're, slowly trying to bring their own people in and push FMC out,
Got
so
it.
I don't
Got
know
it.
what's gonna happen.
So it's just you and a physician that are the 2 providers?
For the 2 hospitals, it's just me and the 1 doctor, and then the other facilities, there's Florida Medical, there's 4 ID doctors and 2 nurse practitioners.
Okay.
So they cover the other hospitals. It's been good.
That's awesome.
I really like it. I
You
really like it. I feel that I love the digging, the investigating. I love being the one to find the stuff. I've gotten so good with the antibiotics now, and we get such a variety of things. There's not like a lot of I mean, UTIs can get a little annoying and get a little old, but like if I get a UTI, it's like, okay, well, how long have you been getting them? Well, has this been going on a long time? Have you seen a urologist? And a lot of them, you'd be surprised, haven't seen a urologist and maybe have a underlying congenital or obstruction or something that I can't see. And so primary right now is trying to handle too many things. Primary is great, but primary is trying to handle too many specialty things,
Yeah.
and then they just flip them out when things are too late. It's just like, "Oh, go see ID." And I get a lot of these patients that I'm like, it's almost like it's still like a chain of command in a way. Like, you don't just jump to ID for a UTI. Like, let's rewind. Let's get you to urology so they can do a cystoscopy and they can do things. I can't shove a camera up there. I mean, I would. I don't know what I was looking for, but I'd go out there, woo! You know? But I don't think you want me doing that because 'cause I'm not gonna,
Right.
but, like,
Right.
so let's just get them there, and then after they find out, "Oh, there's no problems, you're just resistant, and I need to put you on special antibiotics," then come back to me.
But
So
is that happening?
it happens a
Or are
lot.
they like, just go to infectious?
Oh, man, all the time. I can't tell you how many times, and it's usually UTI people. I'm usually like, "Okay, primary made you resistant because they throw antibiotics at you for everything, but you never saw urology." So I love what I do because there's so many different things, I'm consulted for, cellulitis, contact dermatitis, mycobacterium, TB. If there's a rash, a fever, now I'm ruling out, is it, autoimmune or is it infectious? And you learn such a broad spectrum of it all because a white count doesn't necessarily mean that they're infected. And or we have fevers and all this going on and nobody knows why.
As nurses, we automatically who don't know the specialties, well, there's an infection somewhere that they got a white count. That's how
That's how
we
we
think.
think, right?
That's
But
not so what you're saying is that's
not
not
always
always
the
the
case.
case.
Yeah, there's like all these inflammatory markers that we order and we follow them, and procalcitonins for, bacterial pneumonias we like to trend. And, our biggest part on ID is streamlining. And actually it's funny because, before I got into antibiotics as an ER nurse, you think Vanco's like your broad spectrum. You're like,
Right.
that's a broad spectrum. It's like the
That's
least
the
broad,
killer of the killer, we
right? But
think.
it's only gram positives. It's not broad spectrum at all.
See?
And just the things that because we were used to, it was like vancomycin,
Like Rosetta.
vancomycin.
Oh, yeah, like we knew too. You couldn't tell us otherwise, right?
Right.
No, that's
Yeah,
what it is.
right. We really didn't know shit.
We really didn't know shit.
No,
See?
we just, you're like a puppet. I'll hang it, whatever.
Yep.
So that's our biggest part, watching the
Why
culture.
didn't you order da 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 da, like we know, like it's crazy when you think back on it. I'm sure for you, you're like, gosh, we didn't really know shit.
No, we
We
didn't.
thought we did. It is.
Right.
We don't. Like, how do we fix that though? How do we work towards even starting to fix that? Because that is definitely a challenge for me right now. That's how,
Fixing what?
what
Having
do we
these
do?
these baby nurses wanna actually do what's right and not just love it because it's a great schedule and a great pay? You ain't gonna
But
fix
they
that.
won't even ask anybody for help. Like things just get done, and it's like, oh my god, like no,
It's the way of the times that we're in, and it's not gonna get any better.
no. I'm convinced.
I wish it
I would,
was.
I would do too.
Has a residency program too. They take nurses, yeah, right into the, like, ICU, and it's like, I mean, these patients are, like, sick, not only are they in ICU, but they're ICU sick plus cancer sick.
That's weird. Yeah.
I
Wow.
just, so it's just but, remember, like, you couldn't be a nurse in the ER brand new. Like, you had to go get, like, floor experience, and then you went through the program or
Right.
whatever.
Right.
So,
Exactly.
I don't
Wow.
think it's gonna change. I just hope that somebody wakes up one day and wants to be a better caretaker and a better nurse and wanna go home and feel that I mean, that was the best thing about, man, if we saved a trauma and I got my ass kicked, but they lived, man, I went home and was I tired as shit? Yeah, but man, it
But
felt
the
good to
feeling.
know the feeling, the feeling. And so I still get that. Like if I
Oh, see,
discovered
that's good.
something, I still get that. And I'm like, I found it. Nobody else
Okay.
found it. I didn't find it either. Why, like I had this patient because I was off over the weekend, and it's a new patient that's got a brand new Mediport from like a month ago, and she's got this high white count, and everyone could be reactive, this and that, and but she came in and she had an elevated lactic and this white count that wasn't going down. It was, and I went back through her baseline, and it's not her baseline. 21,000 is not her baseline for a white count. When she was here a month ago with a white count of 12.
Right.
So, so she's there 2 days, and it's just like, you have to ask more questions. So I go in and I'm like, let me see your report. Have you had, because her blood cultures are negative, no fevers, but she's still just sitting like 21,000, 17,000, 21,000, a lactic at, real high lactic at first. So I'm just like, so all I did was sit down and ask a couple questions. When did you have it access? On the 30th. Okay. Any problems? No, it was fine. I got my chemo, but yeah, man, when they took it out, all this fluid pulled me. So next thing you know, it's like it took 5 minutes to clean it up off the floor. It was all this kind of like almost like a pus.
Yes.
And the cancer doctor said, yeah, if that doesn't get better, we might have to aspirate it. So right there, it's like, all it took was a few questions about what's new, what's going on, and boom, I got a soft tissue ultrasound, and she's got fluid building up around her.
Oh,
There's your
boy.
white count, baby. So it's
Boy.
like, and you feel good, you're like, because they were going to discharge her today and just say it's a reactive leukocytosis. And I was like, I'm not convinced.
See, that's awesome.
Yeah. So I still get satisfaction and being that investigator, and if I don't know it, you better believe like I'm looking it up, I'm researching it. Like I'm not going to just toss the towel in and just say, well, they have a bloodstream infection, but I don't know why, but their new cultures are negative, they can discharge. I That won't sit well. I want to
Okay.
know, why do they have this infection? Where's it coming from? Because if you don't get source control, that shit's going to come back when they get off the end.
Right.
But
Oh
that's
my
not how
goodness.
everybody thinks. So I don't know.
Well, this is great because how often, like, we all know so many people that have gone on to school and gotten their nurse practitioner or mid level, whatever they are.
They're all
They
doing face
don't
stuff, aren't
never.
they?
Right. They are. we never hear of anybody doing infection prevention, like, never. So
Yeah.
this is great, like, seriously, maybe more people will be, like, interested in going that route, because I never hear about many of them doing that.
There's not a lot out there. There's not a lot of ID people, I feel like.
Interesting.
So, everything I learned, it's not really, but you need it because let me tell you, I came across a patient that actually is a readmit because, hospital readmissions with that 30 days. I got a consult for a guy that status posts like a lap chole and has an intra-abdominal abscess now. But when I went and so I got consulted, I went back through his chart and it hadn't even been a month since he had his gallbladder out and he was bacteremic. So he was E. coli bacteremic. They sent him on augmentin. Yes, augmentin typically does cover E. coli, but here's the thing, there's sensitivities for a reason. And it's because we are growing so resistant to so many antibiotics that if you grow E. coli, I'm not going to sit there and say, oh, I know Bactrim's going to cover it. This is going to cover it. I'm going to I'm going to wait for a sensitivity because the couple times that you do say, all right, you know what, they're growing this, it'll be fine. And as soon as you let them go, it comes back resistant. And it happens actually a
Whoa.
lot. So
Okay.
so I'm looking through this guy's chart and they put him on augmentin and and I'm like, "Oh, it's fucking resistant." This guy went home with
Wow.
antibiotics and he had a bloodstream infection and a nasty lap chole. He comes back with an intra-abdominal abscess that needs to be aspirated because he was sent no ID was consulted and they sent him home on augmentin and it was penicillin resistant.
Wow.
So
Wow.
like he saw like maybe Zosyn. So Zosyn's like a beta lactam type of penicillin, but Augmentin is your pill of Unison. Unison was,
Unison. Remember Unison?
yeah,
Yeah.
Unison was actually resistant and
Uh-huh.
ampicillin resistant. You don't give them Augmentin.
Got it.
So now this guy's a readmit and he's got an abscess and,
And
so
have you
I think,
learned all of this on your own?
yeah, that's what I was saying. Like I've had to learn because you don't go to school for your
No,
specialty.
you don't.
I mean, mine was family practice. All my clinicals were like in the office with primary care. Oh God, so terrible. But like,
Love
so
your
I've had
primary care.
to, you know what I did? I followed my doctor. I followed my doctor for maybe almost 2 weeks. He does no notes. He just, blah, blah, blah. And after 2 weeks of following him, I was like, all right, doc, I'm going to take Dade City. And if I need you, I'll call you.
That's what you said?
And I took over Dade City like that. And within 4 weeks, I was going between the two hospitals. I learned better like that. And if I didn't know it, I asked him. If I didn't know it, I'm like, I'm reading and I'm educating myself. And I have my little black book. Remember the ER book?
Yes, yes, I
So I
do.
have one for a nurse practitioner. I carry it in my pocket, A through
Okay,
Z. And I write all my stuff down. And I want to be the best version of me in this field. I want to be able,
good. So he doesn't write notes?
he writes them the next morning at 4 a.m. So I wasn't going to learn that part.
No, no.
So I've had to, and I'll tell you what, here's what people don't get is when you graduate NP school and you get your first job, your orientation day is 99.9% about billing.
Are you
I
serious?
was there for 8 hours and I walked out and was like, who's going to teach me to be a nurse practitioner?
Well, I mean, that's exactly it.
I was like, I didn't learn anything besides you're going to get fined if your billing's not turned in a certain amount of days.
Ooh,
It was literally like all this stuff. You got to get your stuff in, your billing, your chart, like all that, like codes. And I was just like sitting there like, shit. Yeah.
I mean, I would have been like, shit, too. I mean, who wouldn't be? It is a business. It
Yeah.
is. It's a business.
Yep. You're constantly
Bless
checking
me.
emails to make sure you make sure you don't get kickbacks and you're not holding up like billing and all this stuff.
So you have to do that too.
Yeah. But my notes are done the same day.
Okay.
I'm too
Okay.
OCD to get behind on anything. So my
Okay.
stuff is done, done, done. I get up at 4 a.m. and I start looking up my people at 4 a.m. And then if
Okay.
I don't have Cameron, I'll start pending notes and then I'll go to the gym and then I get to there and I do a lot of stuff from home.
Nice.
So
That
yeah.
this is awesome. Wow. I mean, who would have known? I mean,
Well, for ID, I would say just start paying attention to cultures because, honestly, I'll give you a tip. There's really three gram positives. You've got staph, and that is always this is stuff I wish I would have learned. If you ever see a culture growing with clusters, it's a staph. Only staph grows as clusters. If it's a gram positive cocci pairs and chains, it's going to be strep or enterococcus. So right there, you can start streamlining your antibiotics because
okay.
if it's not a staph, we know we don't need Venco.
Oh, see, we didn't know that.
So
No, we
that's what
didn't.
I mean. Like our job is to try to streamline to appropriateness and start, reducing the amount of overuse of antibiotics that we don't necessarily need and stuff like that. So you got those 3 gram positives. Pretty much everything else is a negative. You've got some anaerobes, Provatilla,
Yes.
you got bacteroids, your anaerobes like that. But most of them to really is that breakdown, knowing those 3 positives and you look at those and if you want to do ID, it's antibiotics is repetition. It's not memorizing them, it's just repetition and you just start developing into that like streamlining and you just kind of know like, I need to cover anaerobes and I need pseudomonas coverage. So, I need Zosyn that covers pseudomonas, it covers anaerobes. If they're penicillin allergy, I can do cefepime that gives Pseudomonas coverage, but I could add Flagyl to give all the anaerobe coverage. And you just kind of like, you just start, you couldn't learn it in school. Like you learned it to pass the test. But like, honestly, the only way I know it is because I do it every day.
Got it.
And
So
then
you did learn it. I mean, well, it was taught in
you
school.
learn it by just doing it through my job.
Okay.
That's the only way. Like in school, you memorize it to get through. But like, I remember like, that's why when I fell in this field, I was like, how the hell did I get in the antibiotic field? Like, I freaking hated that chapter because it was so hard because you're like, this one covers some positive, some negative, but it won't cover this certain positive or negative over here. And you're like, what the
Okay. Yeah, because I'm like,
right? No, that's what I mean. And you're just like, and our job is so important to make sure that the antibiotics are covering and trying to beat resistance and making sure that we're not giving antibiotics for stupid reasons, which you know here's a real good one, mono. Everybody knows mono's a what? A virus. Urgent
right.
care. What does urgent care like to do? Here's some
Here's an
antibiotics.
antibiotic. Yep.
Right. So, rule of thumb is that if, mono and strep present very similar. You never treat strep without a confirmed strep. But then also, if they mimic each other, you do a mono spot because if you ever just give penicillin to somebody who's got mono, you're going to make them break out in this morbilliform rash. And I actually saw it. And I learned that, I remember that in school. I actually saw it with a patient last week. And morbilliform means measles like. So you get the rash like on your hands, bottom of your feet. She was like head to toe, like miserable. Even after she got discharged, her mom was calling me and it was because they gave Augmentin and she was monopositive, you know?
Oh,
So it's just like little things like that, that, you'll see these like textbook things and you're like, damn, that shit's real.
but who ordered that? Would it
Well,
have
we
been,
ordered the mono. We found the mono in the hospital, but
but who ordered the augmentin?
urgent care prior.
Got it.
And it could take like 1 to 2 weeks after you finish the antibiotics for you to break out in that rash when you have mono.
Ooh,
Yeah. So
this is interesting.
it's
This
great.
is
I
quite
get all the
interesting.
STI patients, man. It's been great. I had a lady actually who had like gonorrhea in the bloodstream.
In the bloodstream?
That's how bad and how long she had it. But I've gotten like gonococcal arthritis because it's you gotta remember it's a bacteria infection. Yeah. So, it's if it's untreated, it it'll sit there and it'll go into the joints. Yeah. I've swabbed a lot of
Wow.
herpes. Yeah. Well, I mean, I work in so I've had I've had pig bites. I had a pig bite. Oh, my best actually
Did
my
you say
here's
a
the
pig bite?
yes, at pig bite, I had well, luckily they didn't well, you have to think of like zoo animals and stuff like that, and you cover like real broad until you get like a culture result.
Oh,
So
okay.
you want to give like anything that kind of penetrates from the soil or something that could have soil on it. you want to cover for like Pseudomonas.
Oh, okay.
Definitely. So like if like a diabetic person steps on a nail or something, we always start with like a Pseudomonas coverage and then we'll like streamline,
Okay.
stuff like that. But I
Okay.
had a guy that had a tusk. The tusk of a pig went into his leg. Um, yeah. I had another lady. I had a rat bite the other day, and then I had a lady. Here's my best story. A couple months ago, this lady comes in extremely altered, and we're ruling out everything. And not only that, she's got like a urine infection, but she's not improving. Mentation, right? So, like 5 days in, the husband, honky tonk, is like, "Oh, well, like 7 days ago, she got bit by a raccoon." Yes. A raccoon. And oh, but you ready? This is the best part. Well, she feeds this is the best. So she feeds these raccoons every day. So yeah, date city girl. So here she goes out there and she's feeding her raccoons and she sees this one raccoon away from the what do they call them? A pack? I don't even know. One's
No.
kind of over here doing its own thing, right? And she got worried. She said, "I think he's overheated." So she went over there. She went and picked it up because she's gonna give it a please. Well, she got bit and it was rabbied, and the guy so Honky Tonk shot it, threw it in the lake. Yeah. And then another one was acting all weird in the bunch. So he shot that one and he buried it. And so I'm sitting here going, holy shit, I'm going to have to rule out if she's got like rabies in the CNS, because the way with rabies works is that depending where you get bit, the closer to the brain, the quicker it can get to your CNS. And once it's in the CNS, you're dead. There's no like, let me fix that. There's no fixing rabies. It's preventative, like with the shot. But now we're 7 days plus in. They didn't even tell us at first. That's what I mean. This is why you love it. You're also like, okay, now we're really behind the 8 ball, but also like, how about you just shot and killed 2 raccoons because your wife was going to give one a bath? You didn't, that just slipped your mind? It's crazy. Like, you leave the ER and you're like, man, you can't make up some of this shit, right? I leave work still like that going, what? Yeah. Yeah. Crazy. Yeah. Especially the one that's acting weird. Well, right. Yeah. Yeah. Floridians just kind of knew the whole like rabies thing. Like, I don't know. I was never taught really about rabies. You just kind of knew. I'm not surprised. Yeah. 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 You shot and killed 2 of them. And then so the health department, the only way you can find out if they have rabies is you got to do they have to have like an autopsy and they have to biopsy the brain. So they asked him to go, he's like, well, the one's in the lake, and they're like, well, go dig the other one up. But then finally, like after we did like an LP and we're trying to run all these crazy like tests, but like out of nowhere, she finally just started to improve. So I was like, okay, I guess this ain't rabies, thank God. Yeah, crazy. Yeah, so that's why I love it, because it is. And I think it might be like especially the area that I work, you know, kind of like the one that came in and wanted to get her she wanted us to see if she had Claudia. Remember the one in the ER? And that was great. She was like, I had Claudia last time I was here. And I was like, Claudia? We were Felicia's like, you mean chlamydia? And she goes, oh yeah, that too. I was like, do you remember what I said to her? I said, Claudia, she sounds like a dirty bitch. You should probably stay away from her. My best moments with you. Claudia. I'm, oh, all right, we'll check for her. Yeah. Oh my God. Jeez. Yeah. 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 No, they are. I'm sure I've got so many more, Yeah. There's a lot of lack of education in the world. Did you guys ever, I know this might sound gross, whoever's watching, listening. My parents always said like a dog licks your wounds, it can help heal it. See, we're from Thinona Sassa, so I ain't surprised my mom said that shit. Why am I the only one that everybody asks? Yeah. It didn't do it, but let me tell you, when I get a bloodstream infection that has like Pasteurella, that comes from an animal's mouth. And my first thing I say to them is like, you have like animals. Are you letting them lick your toe wound? And they're like, well, yeah, I didn't think anything of it. I'm like, I'm going to need you to stop because that bacteria in their mouth is in your bloodstream. And they're like, I know right away. Whenever I see that, I'm like, "Were you bit by an animal?" I'm like, "No, you weren't." Yeah. Yep. I've had a couple of those. I'm like, "Don't let your dogs lick them. I'm gonna need you to wrap that thing up when you're walking around your house. Wrap it up. Nobody needs to be licking your toes." Yeah. I know you don't, and you don't. You don't think anything of it. Like, what if you're sitting on the couch, you've got neuropathy, and you're sleeping, and your dog is just like going to town on it? They don't feel it. That's what I'm saying. They don't feel that. Right. It's crazy. I am. Yeah. It is. It is. I wouldn't do that shit again. Yeah. No, yeah. I'm telling you, like, I hit the jackpot. I hit the jackpot. Like, I did, because like, when I literally I shot my resume to I couldn't even tell you, it was just like click, click, click. I didn't even care. I was like, "You know what? I'm gonna get my feet wet. I'm gonna take whatever. Let me get my learn on." And man, I got that phone call back with ID, and I was like, "I don't even know what ID does. This, that, whatever, I'll figure it out." And then I was just like, the shit did I get myself into? I'm like, I would call my doctor and I'm like, am I supposed to see this UTI? And he's like, oh yeah, we see anybody. And I was like, oh, why am I like, I thought there was a urologist, but I mean, I see, when I say treat everybody, we are consulted on everything. If there's antibiotics involved, we're in it, you know? Yeah. So it's been, I know. Every time I get a student, they're always like, "Oh man, are you when I graduate, are you guys hiring?" And I'm like, "No, back up. Man. You ain't me, man. You ain't me." Yeah, yeah. Hopefully, yeah. I wonder why they're just going to school. Yeah, yeah. That's true. Well, because also they want everybody to have experience. So like when I was even applying places, it was like everybody wanted experience in NP, and you're like, I didn't like experienced nurses in the ER when I trained them. I wanted one fresh so I could mold you the right way and you came with no bad habits. I I don't understand their mind frame. I don't know. My doctor, he liked my resume. He zoomed interviewed me while he was chilling in his car, and he was like, family's important. He's got like 6 kids between him and all his wives, and he's just like, family's important to me. You're gonna still we still gotta work weekends and stuff, but like we just kind of work opposite of each other, and he's like, it'll be great. And I got no complaints, hey, can you cover me? Hey, I'm gonna take this week. I don't really take off work though because my days are so short. It's like, why waste it? I go round, I come home. So, you know, yeah, 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 I do. He's a good dude. Yeah, right. Yeah. Man, I can't reach him half the damn time. That's how much we're like, he trusts me, he signs my notes. There's no questions. Like, I mean, there'll be sometimes I go a couple weeks and I don't even hear from him, and I had to be like, "Hey, man, you still alive? Like, we still cool?" But it's good, man. I see some people with like the APPs are with like their doctor and they round together, and I'm like, oh my god, I'd go crazy. So I trust how I practice, and if I don't know it, I'm gonna learn it, or I'm gonna reach out to him. I'm gonna use my resources. I'm like this with pharmacy. Hey, what's your thoughts on this? And like, you use the people that you can, so you can take care of these people so they don't freaking die. I'm not gonna lie. At one point, I thought I liked primary, but I think it was because when you're in the ER, you fix it and then you don't see it, and then with primary, you kind of like you feel like you could follow them. I kind of wanted to just kind of see what that was like and learn. And I would see people and be like, man, but you in primary, you don't come back unless you've got a lot of fucking problems. I see the primary like once a year. So it's hard to follow somebody in a clinical rotation of 180 hours, You would get the one, and then in your mind, you're like, damn, I wonder what's going to happen with him. Like when we adjusted his meds or we referred them to get their boobs reduced because they're having back pain. Like, are they going to get surgery? Shit like that, nothing crazy, but you always wanted to know the result. I was right. And then I was over it. Then I was like, I don't want to fucking do this. Got bored really quick and I don't want to leave it too long, I don't want to ever get somewhere and be like, man, this sucks. I'm out. So that was the only time, but I did like, but everything else, no, peds sucked. Women's rotation, girl, at the health department, my shoes almost caught an STI from all the stuff that came out of them. I was like, yeah, girl. You remember my phrase? Do you ever remember I used to say, "Good what has insurance?" I always tell her that, man. Good has insurance. So if you're in the ER or if you're in the health department and you're getting your stuff open and checked, like, you know it's bad. It's bad. Right. Oh my God. In the health department, I did pelvics, like, and I'd pull that thing out and it was just like, "Oh," I'm surprised that I should have went back with mid. Praise them because that I just couldn't. I couldn't do it. They have that there? They have why? Really? Like a drive-through? Woo! Yeah, when times are tough. I'm due. I'm due. Maybe I'll just go swing by there real quick. Yeah. Like, thank you for having me. That was awesome. Yes. Let's do this again. Bye. Love you guys.